everybody, welcome. It's been a while here. How are you all doing? How are you doing? I hope you are all fine and good. Let me hear from you in the comment section. I want to be sure I'm audible and I have got people waiting to win something today. So let me hear from you in the comment section. How are you doing? What's your name? Where are you joining us from? Where are you joining us from? Hi, Oluwatomisin. It's nice to meet you again. How are you doing? How are you doing? Hi, peace. Peace, Oyeleke. Good day. Good day to you too. How are you doing? Oluwanifemi Blossom. Yes, welcome. Good evening, everybody. Good evening. Right. Apologies for the last few months break. Yeah, thank God for that, Blossom. Apologies for the break. Well, I can't promise it won't happen again, but what I can promise is that we would ensure to show up as soon as much as we can. Yeah, you all know how life turns out differently at different times, right? So we are going to have a great time today. Trust me, we're going to have a very great time today, and and I want you all to be very much ready. Right, that's me just testing. Right, so today is going to be a little different. I have got only 10 questions for you all. Just 10. Chukwudi Genevieve, welcome. For those of you who are just joining us, I think there are new people here. You're all welcome. This is not a quiz night. Basically, we just come here to learn and to earn, and to have fun, and to discuss and to banter ourselves. Some of my friends here will always challenge me. I hope I get more of that today. Ishaku, yes, right on time. I was going to say that. I was going to mention your name, Ishaku. Welcome. Right. So, well, we matter ourselves and just challenge ourselves, And today we're focusing on neurological system, different, just few questions actually. I didn't have all the time to set the usual 25 questions, so I just managed to set 10 questions out, and they are quite simple. But what we'll be doing today is we'll be increasing the price tag. So instead of, I think it used to be 2,500 for one question. I'm not sure. Is it 2,000, 2,500? It used to be something before, but now it's going to be 5,000 naira each. So basically, we have 10 questions, 5,000 naira for each question you get correctly. And of course, the first person to give the most correct answer. That's the rule. And so that means 5,000 naira for 10 questions, and that makes it 50,000 naira. That's what we promised. I believe that's what you saw on the flyer as well. So that is it. So we're gonna get right into it right about now. Okay, right about now. Um, a little different from what we used to do. So I'm just going to I'm just going to wow. I'm just remembering that something is the timer is not on it. Okay. How do we do this? Well, let's see how it goes. Let's see how it goes, and then we'll figure it out as we progress. I've tried to change the template. You're not going to be seeing it as you used to see it on the screen. I'm going to be projecting it through. I'm going to project the slides to you. So, but yeah, let's see how it goes. Right. So the first question is going to show up just now, right? And once I count my 60 seconds, I'm going to take the question off and just show the answer. Okay. And all thanks to Kenny on the background, who is helping us to collect the answers. She's tracking the answers as much as I'm also doing the same over here. Right. If you have not shared this, please share this so that you can give more people the chance to win. But yeah, right. Let's go. Question one. So, a post lumbar puncture patient complains of severe headache. What position relieves this symptom? What position relieves this symptom? So, you can start giving me your answers. You can start giving me your answers. Let me see if everything goes so long. That will not be work. That will not work today. So I won't be able to put the timer up as we used to do it. But I'm taking note of the time over here. Okay, right. That's it. That's it. And that's us done. Right. So the last person I'm seeing here is Noskaris, lateral position. So I'm going to show the answer now. Oh my God, this thing scattered my work. Sorry about that. But yeah, the answer is what? Flat or supine. Flat or supine. And yeah, I tried to put some evidence to it so that you will all appreciate it better. When I say this is the answer, I'm not speaking from my own head. I'm speaking from um I'm speaking from qualified and respected sources. So, and it's evidence based. So the answer is supine. Who gave us supine first? Who gave us supine first? That is Oluwanifemi Adebari. Adebari, I believe that's the way you pronounce it. Right. Congratulations, Oluwanifemi. You just won yourself a token of 5,000 naira for giving us the most correct answer for the number one question. Okay. Well done. Well done. Well done. Well done. Let's go to number two. Well, before I go on, I'm just going to talk because we've got some bit of time. So you can either say flat or supine, and that's according to the American Headache Society. They say the conservative management of the PLPHDM means post lumbar puncture headache, right? And the things you need to do is put the patient in bed rest in supine solution. If you remember supine position, if you remember, most of us we remember that doctors will always say when they come out, especially patients who's just had some epidural or anything that has to do with they've undergone a surgery and then they come back and they say, don't raise your head up, don't raise your head up. That's the whole idea because it could go, it could the medicine could infiltrate and irritate um the layers of the brain and then the spinal cord as well and worsen and cause headache and even worsen it. So that's it. That's it. I hope you're all happy with that. I hope you're all happy with that. Let's go. Let's go to the next one. I'm sorry the timing. I did not figure out that the timing will not be working today. Oh. And I'm thinking try. I should try to add one. I don't know how that will be possible. I might try. Just give me some time. But let's go to the next question first. Question number two. A nurse is preparing to feed a patient with dysphagia. Oh, a nurse preparing to feed a patient with dysphagia must ensure the patient is in work position. Right. So go ahead. Give me your answers. Give me your answers, guys. Give me your answers. Elizabeth Ajayi, I've seen your answer. Remember, you don't need to follow you know, whoever has put the answer before. All you need to do is give your own answer. You will be surprised that you are the correct person. So, but remember again, is the first and the most correct answer that wins the prize. The first and the most correct answer wins the prize. Right. What is the position that you want to place this patient? This one is quite simple, I believe. Right, and that's us done. Bam. So you just put the patient in an upright position. Yeah, sitting upright. So the last person I saw was actually Nurse Caris, and I'll be doing that henceforth. Last person is not. I know how would you dropped your own, but I'd already put up the answer. I'm sorry. So but before that, I saw Shaku, I saw Peace, all saying semi-foulers, but the actual and the most correct way to put it is the upright position. So we'll give us something close to that before semi-fowler or sitting position. Is semi-fowler the same thing as sitting position? Really? Is it? No, I don't think so. Because when you say or, it means you can alternate either of the two. Um, is semi-fowler the same as sitting position? Sometimes you just question yourself. So let me search too. Right. Okay. They said this difference between the standard fowler position and a semi-fowler position. Oh, it's better angle. Oh, so it's different. It's different. It's different. It's different. It's different. Right. So who gave us the most correct answer first? The person is Noskaris. Noskaris gave us the most upper positionality degree. So Noskaris, congratulations. Congratulations, Noskaris. Don't forget, if you feel injustice has happened, I'm not going to ask you to go to court like some people do. I'm going to settle it right here. So you can just raise your concerns and we quickly review it. And if it's not something we can deal with here, then we can always come back. Some of you have witnessed that we've come back to say, oh, this is correct, this is wrong, and then revoked whatever position we have taken and also given the correct answer. So if you think otherwise, just let me know. But yeah, the rationale is showing up there. Upright positioning reduce aspiration during. I think this is common knowledge, right? This is common knowledge. Okay, let's go to the next question. The patient with myasthenia gravis is about to eat. When should their anticholinesterase medication be given? Don't be carried away by that big English. Just focus. When should their medications be given? And I'm not going to give you a cue or clue. I'm not going to give you a clue. Right. I've seen Blossom. So Blossom, yeah, I've seen your answer. So Blossom gave the first, but is it the correct one? I don't know. Rebecca gave the next. Is it the correct? I don't know. How would you? Yes, good answer, but I don't know if that's the correct answer. Let's wait. Let's wait and see. Let's wait and see. It's so painful that I could not bring up this timer today, so that all of you can see what I'm saying. But pam pam pam, I'm thinking of a way to figure it out. Right. And that's us done. Right. Okay. Well, the last person I'm seeing here is Elizabeth Ajayi. So I'm flashing the answer just now. Yeah. So the answer is to give it before. Now there is no timeline, and I see some of you putting time. Well, there's no timeline. Um, just give it before, and the whole idea is to improve the muscle strength for safe swallowing. Well, if I want to go deeper, I did not really intend to go deeper with the timeline, but since you people want me to go deeper with the timeline, um, I can just read through that for you. But I think the first person that said before is it Rebecca? I know I saw her post. Yeah, I did not really bother about the timeline. So, well, um, what sh- when should their anticholinergics be given? Somebody said after meal. Then the second person said, I'm trying to see who said the after meal, before feeding. So the first person that actually spoke said after meal, and then the next person said 2 to 3 hours after. So that's still wrong. Before feeding, 30 to 40 minutes before. I'm gonna give it to before, although um I'm seeing just seeing some studies that said um that says 30 to 60 minutes is safe and is good. But I'm just gonna I did not intend to go deep with the question. So those of you who gave me 30 to 60 minutes, what I put in my own answer is just give it before the meal. And it's obvious because some people said after. So the test, what I actually wanted to test was, is it before or after? Okay. So who gave me before feed? Rebecca, I know. Congratulations. Congratulations, Rebecca. By the way, the only person who even gave me 30 to 60 minutes actually was Noscaris, and it came in after. So I guess you have probably, I don't want to say what I want to say. Right. So Rebecca, congratulations. But yeah, a more detailed explanation would be to give it about 30 to 60 minutes um, before the meal. But then just give it before they have their meals. All right, let's go to the next question. Question number 4. What medication is used to most commonly stop seizures, or most commonly used to stop seizures? And this is important. This is important because um, you, as nurses, play, we don't only care in the sense that we are not just there to provide support and ongoing care. We also provide emergency services, if I may put it that way. So when we notice a deviation from the normal, we are first, that's why they say first line. We're always at the forefront to be able to provide. So you need to know what to do at certain, though you may not be the one to prescribe, but it's probably sometimes if you're not in a setting where you're allowed to do it yourself, you can just get ready and say, oh, I've got this and this and this here. Are you happy for me to go ahead administering this, if you're safe to do that, if you're trained to do that, so yeah, that's it. So everybody, fine, happy. Right, question 4 is the answer is showing just now. I saw Esther Motorayo last, but yeah, the answer is showing just now. It's benzodiazepines. And the first person to give me benzodiazepines is Ishaku. Wow, Ishaku. Congratulations. Oh, you got your data money back. Yeah. So you get benzodiazepines. This is just by the way. Can anybody tell me some common examples of benzodiazepines? And the reason why I will not I did not particularly mention one benzodiazepine is because there are quite a number of them. So if you just give me one, then what you're saying is limited to that, which may not be correct. I don't know if you get what I'm saying. So I know some people may probably mentioned one or two examples that looks like it, but right. I'm here. Diazepam, lorazepam. Yeah, thank you. So you get what I'm saying now. So we've got those options, and we've got clonazepam, midazolam, temazepam. So depends on what you have in your environment, what you have in your setting, and the situation as well. For example, if it is seizure or some muscle spasm, anxiety, you may want to give diazepam. Most times when it is become status epilepticus, I believe you know what that means. The first line of action in status epilepticus is actually lorazepam. And then other ones, there is midazolam. There is usually I know of midazolam often when we are caring for, when we just want to give people don't want to sedate people for procedures, or even at the end of life. I mean, I use that quite well in my current practice setting. Yeah, so that's it, right? That's it, guys. So, yeah, so you see all that. Ishaku gave us the most correct answer. It's group of medication called benzodiazepines. I think I spell it wrong, so forgive my spelling. Yeah, forgive my spelling, but I think we are good to go. Right. Let's go to the next question. We're already on question number five. We're almost finishing. Good. Question number five. A nurse is assisting a stroke patient with left-sided weakness. Which side should the nurse stand on during mobilization? Which side should the nurse stand on when the patient is mobilizing? Tell me, tell me, tell me, tell me, tell me, tell me, tell me. Which side should the nurse stand when the patient is mobilizing? Which side? So the first person came in as Anwoju Oluwatomisin. Anwoju. Oh, you know the rule. Oh, you know we had this conversation in one of the episodes. Your first answer is what we go with. Is it the first or the last? I mean, I'm even struggling to remember now. What was the rule we said again? You all will remind me. But I'm not even. Let's see whether you are the. I'm going to take your first answer as your answer, as your answer. Or should I take your last? Anyway, time is up. So Chukwudi Genevieve, your answer is the last answer. Ah, okay, Esther Moturayo, and then I'm flashing the answer now. Okay, so what you need to do is to stand on the left side. You notice I've seen the stroke patient with left side weakness. Which side should you not stand on during mobilization? Of course, stand on the left side. Stand on the weaker or the affected side or offer support and stability, helping to prevent falls and build patient confidence. Of course, you can tell if you're on the side that is weak, they know that, oh, I'm weak on this side, and you're able to grab me, hold on to me, help me, support me from that side. That sounds like some motivational speech. Oh my god. It's a fun environment, so we're not gonna be unnecessarily formal, right? But it's good. I think the first person who gave me answer is Anwoju. So the next person is, well, Anwoju Oluwatomisin said right, which is wrong. Right is wrong. And Peace Oyeleke said left, which is right. So, and that's the most correct answer. So Peace Oyeleke, pam 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 pam. Congratulations. You've gotten your data money back. You've gotten your data money back. I hope it's enough for you to subscribe for 1 week or something. But more importantly, is for you to study. You know, what we are here for is just to challenge you. This month's own is not it's not as much as we used to have it before. You can go watch the previous episodes. We've done nearly 6 to 7, if not more than that, episodes, and we've covered cardiovascular, we've covered wound care, we've covered a number of systems and stuff in nursing care. And I've mentioned this before. The whole idea is to help us get better in the practice of nursing. If we know better, we will do better. And yeah, so most of these things you can do better with them. And I'm going to just say this. See, I know I'm quite aware that a number of us are young nurses. Whether you're in school or just out of school, um, practicing as a nurse is is largely based on the experience you're able to gather. Now, get me right. I am not one who is given to this whole idea of experience entirely, and I'm going to explain what I mean. If you have not been in a situation where you have to do certain things, you may not know what you have to do, even if you have the head knowledge. And it's very funny because um, you understand the principles, you understand you have a solid understanding of foundation of nursing, but if you have not put yourself in scenarios, and that's why the questions are quite scenario based. We're trying to say, think if you are in this situation, how would you nurse this patient? So, and I've seen that in my own experience, in my own practice, and that's why if you also find yourself you're just starting out as a young nurse, I'm just encouraging you, don't don't kill yourself if you are not getting some things right. Right, just embrace the fact that you're on a learning journey, you're on a learning curve, you're in a process, and put your head into it. Make sure you're studying everything, understanding scenarios, and then backing it up with evidence and understanding why you're doing what you're doing. Right? Whether you're in Nigeria, whether you're in America, whether you're in the UK, wherever, nursing is the same, but the approach to practice is different. So you need to focus on how is it being done here, what should I pay attention to in this setting that I am in, and that's how you gain the relevant experience. And I said that to also say, many times people will say, "Oh, you do it for the experience." You need to be careful. What experience are you gathering? You know, you have to be mindful of that. Some people work in a clinic, for example. What experience are you gathering in that clinic as compared to somebody who works, say, in a busy acute setting? There are different experiences. So you must be mindful, and everything should be channeled towards your goal and your vision as in as well. Back to nothing. Back to the questions. Right, let's go. The next question now. If you enjoy my motivational speech, say I enjoy it. Let me see if I will pass for some motivational speaker. If you will pay for me to come and motivate you. If you did not tell me, I will not go on to the next question. Let me know whether you enjoy my speech. Oh, nobody wants to talk. I'm not gonna show the next question. My cursor is already on the next slide. If you enjoy my speech, let me know. Okay, Rebecca. Anyway, that was just something for fun. Right. Okay, let's go. Let's go. I hope you really learned, and I hope it made sense to you for you. I'm not just joking about it, right? But let's go to the next question. Question number 6. What is the most sensitive indicator of a deteriorating neurological status? What is the most sensitive early indicator of a deteriorating neurological status? Yeah, wings about. Oh, I'm seeing your answers and they're nice. Good. Keep it coming. After this, we are going to take a break, and I will see if I can achieve this timer coming up. I will try again and see because I want you all to see the timer. But regardless, I'm happy we are able to even proceed with this. So yes. Do, 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 do. Right, that's it done. Thank you so much, everybody. The last person I'm seeing here is Uluwanifemi Adebare. Thank you. Thank you. Thank you. So the answer is this. Oh my god. Sorry about all this jargon showing here. I wanted to point out some things. You know, in the previous editions, I always say it's not for learning, it's not for teaching. But this time around, because I am not able to set so many questions, so I have just decided to put some teaching points or learning points the in the answers. So yes, well, the last person I saw was Oluwanifemi Adebare. So let's go back from Oluwanifemi, who gave us the first and most correct answer. The first person that said something said loss of consciousness. Is it really loss? Then dropping eyelids. Well, did you see what my own answer? Before I go on, I'm just going to explain my answer. The level of consciousness. I hope this thing is clear enough. Oh, sorry about that. I should have just removed this heading and made it clearer with this. When I was developing the PowerPoint, it was all clear, and then it got here and became all messed up. Apologies for that. Right. So the changes in level of consciousness. Now, the first thing to note is not that it, it does not this, and the answer to this question is not loss, because we are not saying that. So what you are implying by saying loss is that when the person when the moment the person loses consciousness, that's when you now know that something is wrong with the neurological status. No, there are things that happen before the loss of consciousness sets in, right? So let me just try and read out what, excuse me, the rationale says changes in law of consciousness are often the earliest sign of neurological decline, and the brain is highly sensitive to changes in oxygenation, perfusion, that's blood perfusion, that's yeah, perfusion, you know what I mean, or prayer, and even subtle alterations in the level of consciousness, e.g., confusion, drowsiness can signal rising cerebral hypoxia or early deterioration before vital signs. Now, I was going to say this before your vital signs, you can start noticing on your blood pressure or even your pulse or something. What you may first of all see is altered level of consciousness. That is, you start seeing confusion, the person is drowsy, the person is not able to concentrate any longer, right? And I added this small side note. So the guys who developed Glasgow Coma Scale, Tisdale and Janet, um, they did that based on that clinical observation that the level of consciousness correlates strongly with neurological outcomes. So it's Erika, I know I just said all of this again to reiterate that it is not loss of consciousness that you see first. Well, somebody said dropping eyelids. Donna BJ, welcome. Oh. Where have you been all along? Well, I've been away. You have been here. Donna BJ, yeah. It's not that. I'm trying to see. Nobody changes in level of consciousness. Perfect. And I think that is it. Esther Mutunrayo. New people are showing up on this quiz. Oh. I am so happy to see and have you all here. Welcome. Welcome. So, Esther Mutunrayo, you are the one to give us the first and the most correct answer. Yeah, welcome. Hi, Donna BJ. Thank you for coming. So, I know some people later said something very close, but that's it. Esther Mutunrayo, congratulations. Now, I noticed somebody like Ishaku mentioned confusion, Chukudi mentioned confusion, and I agree that confusion can be one of those things. But the reason why I'm not going to just throw my weight behind one of these one item of all of these things that could happen with an altered level of consciousness, because somebody might be drowsy, may not be confused. I have particularly seen that before. They may not even show that confusion I mean, and they just start going drowsy and then all. So it's safer to just group them all to all that level of consciousness. That's what you notice. And again, remember, it might show up before the blood pressure begins to um, the blood pressure begins to decline or deteriorate in actual sense. One of the most important skill you must have this edition is for me to motivate you guys. So don't miss out on this. One of the most important skill a nurse must have is not clinical skill alone. Well, it's not the theoretical knowledge, let me put it that way, is that ability to make clinical judgment quickly. So able to add one and two together and say something is wrong here, we need to investigate this. And the reason why I said that is sometimes you are not even seeing the vital signs, like we call it, or some people call it observations, and it's not even changing yet, right? But you're seeing something different, something is off. That's your clinical judgment, your clinical instinct speaking there and say, so we need to do something about this, right? And then you can investigate it further, and before you know, you're already picking the the problem, right? And that's what makes great nurses great nurses. Oh, I'm feeling like speaking today. But see all these things that they say, great nurses, beautiful nurses. It's not no, but your beauty will not change the parameters in the blood parameters of a sick patient or anything. It doesn't make any difference. What makes the difference is the knowledge you're able to bring in the practicality at the bedside or wherever your field of practice, whether you're in academia or whatever area of practice you are in. That excellence you show. So that's what makes us great nurses, the ability to be able to pick problems quick and identify solutions. Identify a problem, begin to create a solution for it. It is not about great nurses, beautiful nurses. Blah, 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 blah. Anyway, I'm just ranting. But take that as well. Take that as well. Right? But I'm sure for you to even be on this live chat, it shows that you value knowledge. So I celebrate you. I celebrate all of you. I can't start mentioning all of you, but yeah, I celebrate you. Right. I said I was going to try out this timer thing. Let me see if I can do that. So let's go on a quick short break and I'll be right back. Okay. All right, guys. I'm not going to bother again because It looks like a hard nut to crack, and I don't want to keep you all waiting. I understand that data is expensive, but I know a lot of you watch Instagram for long. So this is a good investment of your time and your money. But whatever the case, I was trying to see if I could get the video and just put it somewhere and see if it worked, but it's not. I don't want to stress you guys. I hope next month. Well, I hope you like this template I'm using. I think it's better because it allows me to tell you some more. I mean, you can see some more stuff. Let me know if you like this template, even without the time. Let me know. Let me know. Let me know. Talk to me. Okay. Ishaku says he likes it. No, Ishaku, thank you for liking it. Let me hear from at least two, three more people. So I know I want to get feedback. Do you appreciate the if you know what we used to do before? I think my opinion, this is a lot better. Yeah. So I believe we are learning better with through this model or this approach. Yes, thank you, Caris. Yes, make it legible. I don't know how it is over there with you, but yeah, I'm able to see. But I understand that some of them I just put them all together because again, I did it quite a rush, and I apologize for that. And then number two, I just wanted you to see some things. Like this one I'm showing you now. I wanted you to see, for example, the glaucoma scale, the guys who developed the glaucoma scale. And I just wanted to explain it deep in more. But yeah, thank you for that, Caris. And I'm gonna make sure that it's a lot more legible. Great feedback. Thank you guys. Thank you. So I'm gonna go to the next question. We have just I think it's just four more questions or three more questions. If you have not won, put more effort. It might just be your turn. You might be the next person. You know how they say it in church. If it's not you, pray. I mean, rejoice with those that have got it, and then it might just be it's in the neighborhood anyway. So let's go to the next question. For a patient with suspected meningitis, what immediate isolation precaution should be started? Right? Put your answers in. Remember the first and the most correct answers. And we've got the time going. So I am able to see the time because I have a timer up with me on my screen. But I don't know. Well, I just you will just trust me. I mean, I've been we've been doing this for a while. We've been together for a while, so you should trust me. But yeah, it's just 60 seconds. At the end of the day, is the first and the most correct answer that wins the prize. So yeah. Precaution, precaution, immediate. Always remember that nurses are fast thinkers. We are fast thinking people. We are fast thinking people. And that is it. So let's go. And Woju, I got your answer last, and that is it. So yeah, let's go. This is the answer. Who got it right? Tell me. Some who got it right. Whoever got it right, you tell me themselves. Tell me yourself if you got it right. Somebody say it is very legible that you should check your from your side. Let me know. Right. So yeah, my brother, my sister. If you know you got the answer, put yourself. How would you correct? Correct. So I would you congratulations because I saw that you're the only one who actually said droplet precautions. And the way it is it's already explained. Bacterial meningitis is really caused by Neisseria meningitis, spread by respiratory droplets, proper precautions, masks, single rooms, all that we have. I'm trying to follow it live here so I can see what it looks like as well. I'm gonna just put it down. Mm, I think it's quite clear. I think it's quite clear. Right. So I think it's quite clear. Oh, I'm so sorry, Dami. I did you wrong. Oh my god. What I can advise is for you to um refresh. Make sure make sure you are live. Make sure you are live. That's important because if you are not live, you will be working at a different timeline. So you all can see the answer. I believe you are all happy with it. Adidora, I'm so sorry about that. Okay, but just try what I said. You've got three more questions to go. But remember, everybody, it is not just about the money. It's about the learning. It's about the lessons you're learning and all that. So um, put that at the as your focus, and let's go right on. So, and would you congratulations? And would you Yeah, you're blushing for yourself. So it's droplet precautions. Okay, brilliant, brilliant, guys. Let's go to the next question. Question number 8. What is the most appropriate intervention to reduce aspiration risk in drowsy neuro patients? Oh yeah, gbogbo yín ẹ máa sọ̀rọ̀ lọ o. Oh, sorry, I'm speaking very I thought I was. uh, yeah. Let's go, let's go, let's go, let's go, let's go, let's go, let's go. Okay. And that is us. Okay. I saw us carry it last, upright. So, um, well, I'm not sure if people read what I said though. Did you read my question? Did you read my question? Okay, okay, you all are. Oh, I get where you're coming from. Unfortunately, that's not the answer. Hey, I got you guys here. Oh my god. I'm so proud of myself for this question. Sometimes people are the one that will challenge me that, "Oh, do you know what you're saying at all?" Today I'm like, I'm the one challenging you guys. At least with this question. All you brilliant folks. So um it's not even about positioning, and that's where you people are getting it wrong. A drowsy neuro patient, you don't want to do anything. You don't want to go anywhere. I mean, you're you have like multiple risk factors there. Multiple risk factors. The patient is drowsy, right? If you are drowsy and they are positioning you up, does that necessarily mean that you'll be fine with eating, or I mean you will not aspirate? Not necessarily. Might reduce the risk, but then what still is that it's now a neuro patient. What if the nerves, what if the innervations to all the swallowing reflexes and everything has all gone? I guess all of you just focused on positioning. It's one of those things that they tell you, nothing can. So everybody just focuses on positioning, positioning, positioning. But in this case, we're talking about drowsiness can impair swallow and cough reflexes. Okay, so that's the rationale there. Increase the risk of silent aspiration, making the patient NPO. I wrote NPO, which is also nil by mouth. NPO is nil per oral. I believe you know that. NBM is nil by mouth. Okay, um, prevent oral intake until a safe swallow is confirmed. And by the way, so what I don't know, not every setting has it this way, but usually what you then do is to do a test. In the UK, they call it what do they call it again? Safe swallowing test, and it's just basically you when for this person, the person is drowsy, so you don't even want to, like, you want to get the person out into an alert state first before you start considering giving anything by mouth. But generally, when the person is to measure or to assess the risk of swallowing, or the his or swallowing generally, you want to do a safe swallowing test. You can look it up online and see what that entails. Okay. My God, we're almost 1 hour. Oh, it feels like we should be here for longer time. Anyway, I mean, it feels so much like just 10 minutes. But it's because I'm actually doing plenty talks and motivational speeches. Okay, okay. Let's go to the next question, guys. Question number. I should add music to this thing. I'm not feeling myself as there is no background music. Let me go and look for background music while you people are answering the next question. Question number 9. So, what simple bedside test? So, I'm going to start counting from 40. Okay, so what simple bedside test? Yeah. Okay, oh, okay. Answer question. Answer question. Oh. Let me go and look for my music. Even if it is 2 minutes to go, I'll play my music for you. Yeah, I've got one. Let me see. Let me see into space. Which one is interesting here? Hmm. 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 Ah, I've forgotten time. Oh. Oh yeah, oh yeah, oh yeah, everybody. Oh, give it to me, man. Yeah, 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 yeah. Okay now. Ah, yes. Guys, that's it. So, answer time, answer time, answer time, answer time. Time to get the answer. Let me reduce the volume so that people will hear you. I hope you enjoy my music, by the way. So, the answer is smile, smile for me. Oh my God, I think I should go for audition. Oh, smile. Who gave us the correct answer? Ah, yeah, the first person said physical examination. No. The next person said focus on positioning. Oh no. Ask the patient to smile. Blossom, 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 blossom. Ask the patient to smile. So, Blossom, thank you for that. Giving us the most correct answer. The first and the most correct answer. Thank you. Thank you. Thank you. So, what is it about? What is the rationale? So, asking a patient to smile helps to quickly identify facial droop. Yeah, she's so glad. She's gotten her data money back. Which is a hallmark of acute stroke. It's part of the FAST, that's face, arm, speech, and time tool used to access or use in early stroke recognition to detect facial weakness muscles. Oh, what am I saying? Facial muscle weakness due to cranial nerve 7 involvement. Ah, how many of you still remember this cranial nerve we crammed in nursing school? Oh my God. I just tried to remember that thing the nurses council some years ago. Oh, that's good, Blossom. Blossom, yes. So a smile, and it's so funny because tell them to smile, and it will sound very, very, you know, harmless until you realize that Uh, they cannot smile. Ah, may God not take our smile away from us. What? People should. Today is everything prophetic teaching. Oh God, people are not rating me. Supposed to be pouring pouring money like this in the account, in my account, as I'm giving you all this word. Oh yeah, just joking. So yes, it's a simple way to know if stroke is setting in, or even if stroke has set in. One of the things you notice is that there is facial asymmetry, and the person is not really able to. So the smile is because they call it, is it factitious laughter or something, the smell is quite awkward. It's not like what the average person without an illness would have. Right, guys, let's go to the last question, because it looks like we want to sleep here today. It's been fun all the way. I mean all the inspiration that is coming, it's not from here, it's from above. Hmm, it's from above. Right. And the final question for today. Here we go. 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 A patient with migraines reports tingling, visual horror, and progressive speech difficulty. What is the priority nursing action? Your own priority nursing action. What do you think you want to prioritize in a patient like this? What do you want to do? 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 Give it to me now. Count down to 60 seconds. Don't forget to you. Anyway, I'm not gonna talk. So give me your answers, and I will give me your answers, and I will give me your answers. Ah, may God not take our smile away from us. No, God cannot take our smile away from us. No, it's not God that will take our smile. God is a good God, but like situations that takes our smile away from us. Huh. Okay, guys, thank you all. Thank you. I've even gone beyond my normal time. Well, because it's the last question now. Well, thank you. I'm going to take Noskaris as the last person, and I'm going to just flash the answer right now. Oh my God. Why did this thing scatter? Anyway, apologies again. Apologies again. Apologies again. So I hope you saw the answer. Rule out stroke. Oh, sorry, Esther Motunrayo. You came in late. You came in late. The first person to give us an answer said something like assessment. Yeah. But what assessment? What in particular? Safety. Somebody said visuals. Somebody says Gazogoma test scoring. Somebody says assessment. Did anybody talk about, like, did anybody even mention stroke, neurological assessment, tingling, safety, assessments? Oh no, assessments. Okay, no. Somebody say assessment for Stroge. And Wojulu Atomisi 2025. Is that your version of stroke? Is that your version? Is that your way of putting stroke? I actually understand what you mean. Yeah. My wife is already shouting, just give her, she's right. So thank goodness for your advocate in the room. And that I perfectly understand what you meant by assessment. So let's look at it together. While migraine with oral can involve sensory and speech disturbance, Migraine usually have that sensory speeches, but the presence of this new progressive speech difficulty that the person mentioned must be treated as a potential stroke until otherwise. So you need to escalate that. You need to, you need to just talk about that quickly and just oh, this is something to watch out for. Guys, don't worry. Next one, we will not have all this overlapping again by God's grace. We're gonna make sure that that doesn't happen. But I believe you enjoyed it. So that's the end, guys. That's us finished with 10 questions. I think some people went home with more money than they used to go home, and some people did not get this month. Sorry about that. Sorry about that, my brother and my sister. It's not my fault, too. It's not. I don't have hand in it. I only ask questions and I ask you to answer. But if you have won anything, congratulations. What we are saying is we are rewarding your passion to study. We are rewarding excellence. Some people spend hours on TikTok making live video, doing nothing that is impactful or reasoning. Excuse me. And and no disrespect, but what value does that have? However, you have spent this 1 hour, you have spent this 1 hour thereabout to know more about one or two things more about nursing and neurological, the care of patients with neurological disorders, which is very, 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 very impressive. So I appreciate you most importantly, and I appreciate the fact that you set our time. I think over 20 of you joined today, and to all of you who keep asking us when are we doing the next quiz, thank you for putting me on my toes. I mean, it was just one of those days. Somebody asked my wife, I'm like, when are you doing the next one? I said, okay, just put the date to it. We're doing it. I don't care. And that's why I didn't have time because, um, got all that commitment. But I just said, we're going to do it anyway. And then while doing that again, I figured, oh, let's try to put the questions out in a different way. So I'm happy we made it through for today, and I'm so happy to have you all. I've got new friends on here. I'm not sure I have you all on the channel. So if you are not on the channel, go there and join. I'm going to show you how to join. It's simple. Join the channel. I think we have 80 of us now on the channel. 82 or so of us on the channel. So just join. That's where you see you get the link and everything to join when to of course for the and then even other things. I know I've promised that we're going to do we are going to tweak this whole quiz thing for a long time. I promised that we're going to do something where people would come in and will compete head to head. So the way we're going to do it is I'm going to drop a link on this very channel, and you just register. So we then select and bring you on board. I will tell you in details the selection process. I'll put all the details on the channel. It may be for the next edition. If I'm not able to put all of that together for the next edition, we'll do it. We shall do it someday. Someday, sometime, somewhere, we'll do it. But yeah, we'll do it. We'll do it. Now, if you want anything, please message this number. If you got any answer, I've not changed this thing still. But yeah, just if you got any answer correct, just mention that. I know some of us are joining you, so you need to and just go into the DM and say just say I from it's not me. It's not me that gave you that. I'm sorry, it's not me that you're chatting with. Sorry, I was carried away by one of the comments. I'm coming back to that comment. It's not me that you're chatting with, so be mindful. Don't say sir. It's not. Just say I got all of this and just I just want to claim my prize and that's fine. Okay. Yes, thank you all for your feedbacks. I got that. Well done. Thank you. Um I really enjoyed this. I've been challenged. I would you say that I don't really like honestly me too, I don't like him. You see say Naim it came last in my option. I don't really fancy it. But you know, yeah, I was gonna say this. I thought about part of my how do I put it? My motivational speech for you guys today is to, you know, if you're still, of course, I'm speaking, and I'm careful saying this. If you're in Nigeria, um, there are different pathways to developing yourself. But one of the things I strongly advocate for is to build expertise in an area. And I know that in the UK, for example, there are nurses who are specialists in managing headache. It's very funny. In the Queen Elizabeth Hospital in Glasgow, there are specialist nurses in headache specialist nurses. In I know there are people like that, and that's because headache is not just headache, and that's what we like to try to tell people. A lot of patients and families who just take paracetamol for every headache. There's a lot that could be going on with headache, and I'm mentioning that because we are studying neurological system. So the prospect of nursing is so broad. Now, even if you are in a setting or in a country where those specialties or special areas of specialties generally are not available, and what I generally advise is, as you advance in your education, tailor your education to that path and be intentional about it yourself. So the world is a global village, right? If you want to connect with people who are doing something you like, you can easily just look them up online. And before you start asking them for mentorship or anything, do do as much homework that you can do, right? And then you can build connections. If if you want to do, say, if you want to do something that's really not in your terrain, there's a way to always connect, and you would find that it's not as hard as you think. It's only that you don't have the right information, right? And you can do it. So maybe that's my final motivation for you guys. You can do it. So there's so much more available than midwifery, public health, and all the ones we already know. There's so much more where you can become an. Um, I mean, recently I met somebody who is a professor of diabetes nursing in King's College London. Very, 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 very challenging to me. Professor of diabetes nursing, and even in that, he focuses on an aspect of diabetes care. So that's how it is, guys. So if you don't have interest in neurology, it's fine. Whatever area of interest you have, begin to explore it, right? Begin to put more effort into studying about it, and you find yourself there soon. Of course, with the help of God. I'll see you all again some other time. Thank you so very much for joining. And please don't forget to subscribe. I know if you find it valuable, then you put just subscribe. But if you think it's not good enough, well, it's okay. But I don't think we're not doing bad. We're not doing bad. We're giving you good value here. So please subscribe, and I will see you again when I see you. Not next month. I can't. No, I'm not saying next month. But I'll see you when I see you again. Just watch out. Please just follow the channel, and you will get all the notifications that you need to have to know what we are doing next. Right, guys, thank you so very much, and bye for now. Just after now, you'll be seeing something playing. So, right, bye, everybody.